My name is Dr. Peter Rowe. I'm a consultant renal physician at Derriford Hospital in Plymouth, and my job is to look after patients with all types of kidney disease, patients receiving dialysis, that is treatment for kidney failure, and also after kidney transplantation, which is another treatment for kidney failure. Kidney failure is a difficult disease for people to understand because there are very few symptoms. In other words, people often don't complain of anything wrong with them until it's very late, until it's very well advanced. So it's often difficult to know that there's actually anything wrong until quite a late stage. Blood tests are usually used to make the diagnosis, and they can be done very readily by general practitioners or in hospital. And usually the diagnosis is made on a blood test showing impairment in the kidney function. Blood tests are very reliable at doing that and very useful. The kidney has such a lot of reserve function that you don't feel any symptoms of anything wrong until the kidney function has got to about 10% of what it would normally be. So you can feel perfectly normal with kidney function of 50% or 40% or 30% or 20% even. It's only at that sort of level of function that you begin to feel things wrong. And the sort of things that you notice then are things like fatigue, lethargy, tiredness, feeling the cold, perhaps a bit of fluid retention manifesting itself as swelling of the ankles, sometimes a bit of breathlessness, no get up and go, just being a bit off colour, not eating properly, appetite not being well, a bit of itching, a lot of non-specific things that really don't often make you think there's something wrong with your kidneys. Dialysis is a treatment for kidney failure, and I think it's important to say first of all that many treatments can be given for kidney disease that will prevent or avoid the need for dialysis. And that's why we like to investigate people thoroughly and advise very careful treatment of blood pressure and that sort of thing in patients who have any problem with their kidney function.
My name is Chris Bruce. I'm aged 44 and I was diagnosed with chronic renal failure in June 2003. I was living in Rugby, working in Corby as a product support engineer, which was telephone based, travelling back and forwards to work every day, 2-hour trip. I have 5 children. I inherited 4 when I got married, and I've had one of my own since then. And it's just a busy family lifestyle. When I was originally told I was going for blood tests for a completely different situation, and that was on a Friday morning, routine blood tests. I then got a phone call from my GP on the Saturday morning, so I went in to see him and he explained the situation about the blood tests and the results of the bloods, and he sent me into casualty in Saturday afternoon, and it happened as quickly as that, and it was devastating. I'd had a renal condition since 1991 and it was fairly stable blood results up until that point, and I didn't realise I was ill. The initial thought that I had was that's the end of my life. It's such a shock to be told that you now have renal failure. I think, well, what's going to happen now? Yes, you're told that you could go on to renal dialysis or haemodialysis, but you don't think about that really. That's something in the background. And you think, well, yeah, I've got the blood results now, they are bad, I have to go into hospital to get that controlled. Can they control it on dialysis? Am I going to come out of hospital? And it's really such a shock to the system, even though you've been sort of prepared for it for 12 years or so, knowing you've had a condition. The day you're actually told you have renal failure, your world stops. My wife knew about the condition anyway, but again, it's one of those things, it could happen, it may not happen. And we just had a little lad then, he was 2-year-old, and just my life basically. And the worst fear I had was him growing up without the father, without the complete family. And that hurt me more than anything, more than the dialysis situation. It was the fact that I might not be around for him to grow up. And I was originally in hospital for about 2.5 weeks with getting the blood results down to normal levels, having the operation for the fistula in the arm, and then getting to go home really and spend time with the family again. When we started to go on dialysis, you were given choices of which form of dialysis you wanted to go on. You were given the choice of whether you wanted to go on CAPD or whether you wanted haemodialysis. And then they give you the information then in leaflets to read up about it to see what's going to suit you. And I looked at the CAPD and I thought, well, it means you've got your freedom, you can go around, do what you want, you don't have to be tied to a machine for 4 hours, but you've then got to carry the equipment around with you all the time. And trying to fit that in, if you're working all day at work You've got to try and fit that in, find somewhere quiet and out the way and private, really. So I opted for the haemodialysis. It was an easier option for me, even though it's disrupting your whole lifestyle. But having to do that, it's, as far as the actual process of doing the dialysis is concerned, in a way it's in somebody else's hands.
There are two main types of dialysis. One type is called haemodialysis, and that's where the blood is taken from the body, from the system, and passed through an artificial kidney, an artificial filter, some people like to think of it, which filters out the poisons in the blood that the kidney would normally remove. The actual process of haemodialysis takes about 4 hours and has to be done in hospital usually, so it does tie people to coming to hospital for their treatment. The other type of dialysis is called peritoneal dialysis, and that's sometimes referred to as CAPD. In this type of treatment, instead of the blood being taken from the body and passed through an artificial kidney, the fluid is put into the abdomen inside the tummy, and that fluid sucks out poisons from the bloodstream. People choose different types depending on their own personal views. Some people prefer the independence that is offered to them by CAPD, the fact that they can be at home and they can decide when they do their own treatments. Some people prefer to leave the treatment to another person. They'd rather have someone else do the treatment for them. And in the hospital, of course, the nurses help with that, and they carry out the haemodialysis treatment. So if you add up the total time that this takes, it's about the same. Although in one form of treatment, haemodialysis, it has to be in hospital for a short period of time, 4 hours, 3 times a week, whereas the CAPD treatment is done at home for 20 minutes, half an hour, 3 or 4 times a day. So it's a different way of treating the condition. Both are equally effective, and different people have different views, and different treatments suit different people, both for medical and for social reasons.
My name's Zoe Portman. I am 44 years old. I was diagnosed with kidney failure in 1995. I was on dialysis for 4 years before having my first transplant. When I was initially told that I would need to go on dialysis in 5 years' time, because it was such a distance away, I didn't really take it that seriously. I told my husband and he didn't take it that seriously, and my children were just too young to tell, really. I did feel that I wanted to live life to the full in that 5 years. I did everything at 100 miles an hour and threw myself into everything I did. I worried about what was going to happen to the children, and I just thought it was going to be this one, like a D-Day, this one day when suddenly I'd have to go on dialysis and I'd be in a hospital bed. That's what I thought it would be like. When I had to go on dialysis, finally, I had to tell the children something, because I was going to be away from home. I was going to go into hospital to have the catheter put in. And also it was going to be obvious to them anyway that I was on dialysis, because I'd be doing my exchanges at home. And I was always quite open with them. So I told them as much as I could. And every time I got any information, I discussed things with them. Once I'd been into my dialysis period for 2 years, I started to think, hang on a minute, this is going to take longer than I thought. I thought I'd have a transplant by then. So I'm actually going to have to learn to live with this better. I used to walk the dogs after I got back from taking the children to school. And for the first 2 years of being on dialysis, I would only walk a certain distance because I was afraid in my head that, you know, I was ill and I wouldn't be able to walk very far. And I did feel tired. And I thought that tiredness, you know, was purely my illness. So I'd think, right, I'll only walk this far and I'll get back and it'll leave me enough energy for the rest of the day. And I was compensating for something that I didn't need to compensate for. Because after 2 years, when I realised I wasn't going to get a transplant so quick, I suddenly thought, oh, this is ridiculous. And I could walk miles and miles with the dogs, and I probably could have done that before. But I restricted myself because I thought I was ill. Once I got over that and pushed myself, there was loads of things I could do that I thought I couldn't do. And I was much happier for it. I think that I suddenly realised I wasn't going to get a transplant as quick as I could. So I couldn't sit around. I'd sat around practically for 2 years doing bits and bobs and keeping up with my children. That was one thing, but I wasn't living my life for myself. I was sitting waiting for a transplant.
Most people find the most debilitating thing is the lack of energy. Although the kidney dialysis treatment replaces kidney function sufficiently well to keep you alive and to keep you in reasonable health, it's not perfect by any means. And most people find the most difficult thing is they don't have the get up and go they had beforehand. People tend to get fed up in things at times. Particularly younger people find that the need to stick with schedules and appointments and things can be very difficult, very irksome. Many younger people I live it's spontaneous lives. When you go to the pub, you don't fix it till Friday night and then you go. Whereas dialysis treatment has to be organised and it has to carry on regularly, otherwise you get ill. So many people find that very difficult, and they get cross and they get angry and they get fed up and they get depressed. We help them with that, and we understand that. It's very common, and it's not something that you should feel that is anything unusual. It's not something you should feel guilty about. It's an understanding. We have to tell people about it, tell how you feel, and they'll say, yeah, we know it's awful, but don't let it interfere with your treatment too much, otherwise you're going to get worse, you're going to get iller. Life's about living life, having fun, fulfilling your needs and goals, and to do that you need to be as healthy as possible. So there's a balance to be struck there between being what we call compliant with treatment, in other words, following the advice we give you fairly carefully, but also having some spontaneity and some doing things on the spur of the moment and living life and enjoying life.